Hello, everybody. It's so good to be here. It's Paula Nutting, your musculoskeletal specialist, and it's a pleasure to see you guys for our monthly Ask Me Anything catch-up. These monthly anything catch-ups are all about giving you, the therapists, or even people who are just interested followers, an opportunity to hear some of the peers and what they have to say about our industry and how we can help and nurture the patients and clients that are in our care. Today, I'm really excited to be getting in touch with Danielle Valoras, who I've actually met before when she was over in Australia to have a brief treatment from me, which was very exciting. She is someone who is passionate about the dangers of breast implants and what they actually do to the body. And I thought this was a really poignant thing for us to be talking and unpacking, because we either have a higher and higher incidence of patients and clients that see us who do have breast implants, or in actual fact, many therapists that I know do actually have breast augmentation as well. So I would like you all to welcome and to have your questions ready to the fore and to type them into the chat box while Danielle explains the dangers and the protocols that we can do for people who come in to see us where we suspect there might be inflammatory responses or dangers with breast implants. So Danielle, come on board. It'll be great to see you again.
Hello, Paula. Thank you for having me. It is great to see you, actually. And we were just talking, I think it was 2018, and I had just explanted and had traveled to Australia to see Elizabeth Lambert, and she's a naturopath out of Brisbane, and then also you. And that's when I was first, I keep waiting for you to come to the States again since COVID to teach Chapman's reflexes, right? But that has a lot of, so much to say about that and connectivity and healing and helping me heal. So I appreciate that time and then the continued friendship. So thank you.
Yeah, in fact, I think it was 2018 you came here, and then 2019 I was in the UK and God knows where, Ireland, and then I was supposed to come to see you in 2020 from South Africa, you guys to be teaching, and then the pandemic. Well, there you go.
Yes. So soon, hopefully.
Yeah, 2023. I'm planning to try to get down to Eric Dalton's course in Costa Rica, hopefully. So I'm going to see if I can link everything up and catch up with you as well.
Oh, I just got back from Costa Rica, so I really love Costa Rica. It's a very healing place for me. So
so as much as I'd like to be talking for 45 minutes to an hour with Danielle about our adventures, I think I probably should introduce her properly, and then we can get this going and find out how we can assist our clients and patients. So Danielle, give us some background on your journey with what you are as a practitioner and maybe your own health journey.
So I've been a PA since 1999, and in the US we're like liaisons, and we can have our own licensure, and we can diagnose and treat patients. But that was kind of on the back burner. In 2015, I had lost about 40 pounds. I was 48 and looked in the mirror and thought, I just want to get a pair of breast implants. And what are the risks? What are the problems with it? And I went through, I did my research, and they were fine. And I saw different plastic surgeons and came up with the point that I was going to get some implants, and I did. And within 3 months, I didn't know that it was the implants, but I didn't have the robustness or the vitality in life. It just started to dwindle.
And hey guys, it's Paula Nutting, your musculoskeletal specialist. And this is that awkward, cheesy kind of part of the video where I ask you a big favor. So if you want great content and lots of information, you can see down here in the little testimonials, there's free manual therapy information. There's really cool stuff on necks, shoulders, backs, hips, wrists, arms, etc., etc. I've got amazing Ask Me Anything podcasts and vodcasts that you can get free access to. if you want to get that great content, can I please ask you 3 things? 1, can you please subscribe to my channel? 2, can you hit the like button? And as they say, just smash the heck out of that like button. The more information that YouTube gets to me, the more I can give content to you. And if you can click on the bell, that will also give you timelines for when I'm actually dropping something into YouTube so that you can access it really quickly. So subscribe, like, and click on the bell. And I'm hoping to get you as much great content as I possibly can. Paula Nutting, your musculoskeletal specialist.
And within the next year and a half, like pain, lack of use in my left arm. Now, everyone's symptoms are going to be different. Some of the key things are like hair loss, puffiness, weight gain, like edema, but not lymphedema, right? Anxiety and kind of a depression, which is not my personality. And then fatigue was amazing, amazing. Brain fog and all of that. And then finally I explanted, and I would say that improved about 70%, maybe 80%. And that's when I really knew, after I explanted, that, wow, this has got to be the implants, right? I was lucky because the physician I had gone to had taken out all the capsule and things like that. So from then on, I had been studying functional medicine for a whole other reason. Family has a history of autoimmunity, which if you have a history of autoimmunity or your family members do, autoimmunity, asthma, allergies, then I would say be careful with any implantable device, especially for cosmetic reasons like breast implants, right? And so that I could not ignore it. And then I just dove into why the where, what, when, and how this happens to us. And I don't know that I have all the answers, but there's a group of us that are committed to entering like a roundtable discussion to help people go through this journey and cause awareness, so that way we don't have to take 2 years or more before we're diagnosed an explant.
Yes, it's really interesting because we kind of presume that it's because of leaking of the implant that there's pathologies and issues. But in this case, you're not saying that that's necessarily at all.
This is where I have to like always take a deep breath when this comes up. We know there's like the literature out there that ruptured silicone implants are bad. We know that they can cause autoimmunity or an immune response, or like people will arm wrestle over, is it Asia? Is it the silicone? Is it the platinum? Is it the metals? Is it the chemicals? What is it, right?
Yeah.
At the end of the day, what is interesting is no matter if it's saline, no matter if it's silicone, that shell basically becomes permeable. So what happens in the shell, which is made of silicone, is that let's back up a little bit. To make an implant, you have to have different consistencies of silicone. To make the shell, it has to be kind of hard, kind of protective, kind of like, let's keep the contents inside. In order to do that, you have to cross-link it with things like platinum and tin, so it becomes hard. But all of it doesn't get connected. So those kind of begin to fall off and fall away, and the shell becomes permeable. Basically, the shell is permeable right out of the box, or in the box it's permeable. In the old days, they used to have to put like I'm simplifying, a paper towel, because the silicone would leak out and it would feel greasy. So they put a paper towel or a absorbent little patch so that way you can't tell. So it's leaking straight away. The saline ones too. It's the shell that does this thing. And then you leak this stuff into your body from day one. You can look at, for the geeks out there, you can look up something called the Summary of Safety and Effectiveness Data Sheet. It's called an SSED. And they'll
Okay.
tell you about something called gel bleed.
Yep. I've heard that term.
Yeah, but it's not because of the gel in the gel silicone implants or gummy bears. It's the gel of the shell. You can see I'm already getting like red. I get so talking about this stuff. Yeah.
Perfect.
Which
someone's got to be talking about it, because otherwise it just slips under the radar, doesn't it? Like,
yeah, but there's good news, right? So it's not all. Sadly, every implant does that. And what we have now, thanks to a doctor by the name of Eduardo Flores out of Sao Paulo, Brazil, he's a oncology radiologist, MD, PhD, who has studied MRIs, imaging. And so for us, people with implants, you can get a breast MRI. There's a caveat. There's with contrast and without contrast. We'll cover that in just a minute. But you get a breast MRI with implants, and you can, if you have something called a silicone-induced granuloma within that breast implant capsule, right? So you have the implant, then your body protects you from that implant right away and builds scar tissue or a capsule. And if you have this granuloma that develops, then you know you have an inflammatory process that your body's reacting to. And there's data. He has publications. We can provide that if people want it. But if you have this on MRI, then this inflammatory cascade, and any naturopath or functional medicine provider or integrative medicine, the first thing we're going to do to help you is decrease the inflammation. Or have you do lifestyle changes to help yourself decrease the inflammation. But if this is a constant thing, then you know where potentially the root is, right? So then you can have the implant removed and the capsule. I would remove all the capsule. That's my advice to people who ask me. Yeah.
It's interesting. So actually remove that capsule, the body's response, that capsule.
Yeah. Yeah, well, it's there to to protect you from the implant. So it's the catcher's mitt, right? And so hopefully, genetically, you can give a good catcher's mitt or make a good catcher's mitt. Some people overmake the catcher's mitt, and it becomes what they call contracture or a Baker's 4, and then you have the deformity where one might be up and one might be down, and like it can be painful, and that's a contracture, right? But then some of us don't make a capsule so easily. Why is that? So we're still looking into that. I don't have all the answers. Is it genetics? There's different things, but I want to make sure we're all clear. It's not your genetics that caused the trouble. It's the elective procedure called breast implants in this case, right? Sometimes you have to get a pacemaker or hips or knees, and your body's going to respond immunological ways to do what it needs to do to protect you and keep that joint moving, keep the muscles going, keep you safe, try to decrease the inflammation, right? And that's what the scar tissue is. And in breast implants, we call it a capsule, right?
Yeah, wow, okay.
It can go all the way up to here and all the way down to here, right? And what's right here, right? The brachial plexus, the lymphatics, and you think of lymphatics and the drainage and the now.
And I'm talking to Gil Headley next month. He's our the fascial buzz guy. So it's just making me think, those capsules, they're a deep, like as in connective tissue. So it's almost got a fascial weave. It's a structural fascial weave.
Your body is amazing. And in fact, I had an opportunity to see Gil in Charlotte, and he had an example of a breast implant.
Wow.
Yeah. Well, a cadaver with a breast implant. And it was amazing what your body does to accommodate what we do to it. I mean, it's amazing from a cellular level to a fascial level. It blows my mind. What they used to do when you had that capsule of contracture is smack you and break it so you'd have freedom to move. And versus the constricture. But I digress. Sorry.
And interesting, because we've just got a comment from Regina, who's saying, I'm glad this is getting discussed in Australia. She's found a lack of support in Melbourne and around BLL, and more specifically around removing the whole capsule, because there's a reluctance to remove it if it's adhered to the rib.
Yeah. Ooh. Regina, hi. I think it's somebody I know. And this is branched chain amino acids.
So much healthier than coffee.
Yeah, well, it's 7+ years. So, yeah, I think she meant BII, so
yes,
breast implant illness. And there is, it's appropriate to be concerned about removing the capsule from the posterior wall, which is I should have like little, netter here, right? Which is right up on the ribs, and you got a rib, then you have intercostal space, and then you have a rib, and then you have intercostal space. Yeah. And it's what is, I don't know if you can see that. What is that? Like a couple of millimeters.
Yeah.
I mean, it's not even a whole centimeter thick. If you're lucky, you have a centimeter. But that scalpel blade or the electrocautery to take that off is not as delicate as in between that rib space. So it's not necessarily the rib, it's what happens between the two ribs. And if you dent that or stab that or accidentally slip that, because that capsule, one, it's sometimes hard to see. Two, it's calcified. It's hard. You have to really be aware, but you can go through that. And what's right under there is either the lung, like literally your lung, or the cardiac, the heart, right?
Yeah, you've got all your pleura. Like you've got all that pleural space. You've got the capacity to actually just puncture that and then create a pneumothorax or a hypopneumothorax. There's a mile of stuff there.
Yeah, so you want to go to someone who specializes in this explant, because they then are trained, and then the risk goes down greatly. If we like to say in the explant world, remove it all in one. Take the capsule out and the implant out together, because you don't know if it's ruptured until you get in. You can read the statistics. But there's silent ruptures and you don't even know that it's ruptured. And now we know that it leaks, since in the box, and then in your body, it leaks some more. So you want to just take it out as a package. Some people call that en bloc, and some people call that one and done. Some people call that a total capsulectomy all in one, or a precise capsulectomy. So
it's interesting because Regina's just saying that she's got experiences pain in her ribs at the back. I concerned that the remaining capsule is doing what it was doing to the body. But for me, my brain goes to the Chapman's reflex work, because we know that pain in the back is quite often because we've got defense pattern closed down of the anterior. And just by stimulating, like just getting in it and stimulating that whole area. And remember, I think we did that with you, and then the central line up through the shoulders, and really cleared a lot of that back pain because we're actually opening at the front. So maybe, Regina, if you're a Melbourne girl, I might be able to find someone who does Chapman's down there that can maybe do some assessment and assistance.
That might be really great. And the sympathetic chain runs right under every rib. So if that is at all tight, how are you releasing? How are you even breathing? Like, you think about taking the full breath, or like so when we have silicone in our system, and anyone who has breast implants does, it's how do you function with it is the other question. But it goes through your whole body, and the lymphatics dumps into the liver, and then the GI tract, hopefully, and then you can excrete it, right? But I just was reading with 2 articles that low molecular weight silicone, you can actually expel it through your breath. So breath work is also beneficial. But also, what is it expands your intercostal space, which then decreases your sympathetic overdrive and helps you with parasympathetic, right? So, sorry.
I know, but it's and I get your passion, because it's a passionate topic. So
it's all connected.
Yeah. So you're talking about lymph, and we know that lymph is going to be a big way to clear this. Yeah.
Yeah. And so depending on who's listening, right? Like if you're a therapist, open the drainage pathways. Open every time you see anyone, open the drainage pathways, lymph, liver, kidneys. So I've had the pleasure to learn through the Baral teachings and the Chikli teachings on lymph and then viscera, right? Like open up the drainage pathways. From a functional medicine integrative position, open up the drainage pathways. If you're constipated, don't think about detox until you can go to the am I allowed to say poop? Go to the bathroom,
you can
right?
you can even say crapper.
Crapper, right? Like if you're not going 2 to 3 times a day, like kind of formed stools, then your detoxification or one of the drainage pathways is inhibited. If you're not sweating, your drainage pathway is inhibited. Many BII people don't sweat. Their mitochondria are dysfunctional, right? So that should be like, it blows my mind how people say, oh, I need a detox. No, nutrient rich, support the system and open up the drainage pathways, get the liver working.
So Danielle, if we've got people here who are listening in that aren't therapists, can you show a simple?
Oh, yeah.
Yeah, and even for therapists who maybe haven't done manual lymphatic drainage, is there some?
Yeah, you can. Sorry. So you have a collarbone here, right? Like that hard bone right here. Literally, this is it, right? The left side is the main.
This is left for us.
Yeah. Main port, left side, 70, 80% of the lymph goes through there. And it comes up from your feet up to here. So just tapping here, you can tap here, you can, however you want to tap, it can be light. Literally just doing this will help.
And how long do you get them to do that for?
I do it every morning let me just try to, I just tap 5 times. And when I'm stressed, I'll do it a little bit more. And then sometimes this is first. Perry Nicholson, Stop Chasing Pain. He has some great lymph mojo workshop too. That is easy.
Down through here,
And then right below the sternum and that xiphoid process where the ribs are here, I'll just tap. Sometimes that can make me feel a little nauseous, so I might just rub. But honestly, those are the main things. You can rebound, you can dry brush, you can do. But for me, the tapping works and breath work. It's not even work. Make your lungs just expand. Some of us are going to expand like this. Some of us are going to expand like this. Just breathe deep. And that's really great. When you, there's your armpit here.
Yeah. Some
of us might have, it might feel full. Some might have lumps, right? Like I should have worn a tank top. This pec, your pec major, right? You don't need to grab it or anything, but just be gentle, be nourishing, right? That's lymph. It doesn't even have to be that hard. It can just be very gentle. And I do both sides, and then I'll just tap. I actually already feel better. The autonomic response should be fairly quickly, right?
Yeah, I was going to say that deregulation of sympathetic and upregulation of parasympathetic.
Yeah. So we can all nap now. It's early for you guys. But the lymph is a big deal. Just keep it moving. Those who have like the severe BII and haven't explanted yet, or even have explanted and still, movement is hard. And breath can be hard and challenging because inhale can cause anxiety for some and exhale for some. Yeah. Just do what you can and think 360 with the breath, right? And and that will be enough for you. Like, you can't get it wrong. It doesn't matter the square breath, the triangle breath, the holding the breath. Just deep breathe where you're at.
Yeah, such a good call, because that's the whole thing. The more that you put anxiety on someone taking a breath, all right, you have to breathe in through this way and out and do that, then you're just creating cortisol.
Yeah, and stress.
That's just stress markers up. I always try to say, just be in a good space, but quite often I go, lie down on your back, bend your knees, because that's a nice, simple way to do it, and stick one of these things on your tummy right there and breathe in and feel it lifting. But maybe if you talk about the electricals,
right? I'm like,
something else, like
a book,
anything that maybe not that. It's just that everyone who normally comes to you will always have one of these. And if you've got a cover, then at least you're not
mode, or
just seconds. It's just to get the feel of where breath comes from. And that's one of the simplest ways. Perry also talks about putting one hand underneath your bottom and bringing your hand across and hanging on here. So you're actually...
when you're having anxiety, that's great.
When you want to take a breath, because it forces you to breathe here, because you're closing the capacity for your upper lungs, your apical breathing, by doing that. So
that's awesome, because I'll hold the lateral sides and have people take a breath in. And I'll follow it on the first one. Most people know I'm going to trick them, right? And then on the exhale for them, I'm holding in as, not this tight, but as tight as I can. So when they go for the inhale again, like, it's restricted. So when I let go, it's bigger for them, right?
Yeah, that's right.
That releases even so when you look at the colon, which is a big deal also for BII, the viscera, the abdomen is so much sympathetic overdrive, even though the afferent pathways are like 4-to-1 going to the brain, but we're so uptight and on fire and inflamed. When you hold this area and when you can find rest in that area, and holding someone in these, the upper quadrants of really where the ascending colon meets the transverse colon meets the ascending and the descending, when you can hold this area and breathe into that relaxes. And that seems to really induce some peristalsis later on in the day, not right then and there, right? So there's so much to say. I don't even like it's
so exciting. I know, it's so exciting. But it's all ways for us to help remove the toxic
load. Yeah.
Now, another one that you were talking about was looking at Carla Stecco, because I think you were talking about your Breast Implant Health Summit.com coming in on 21 to 23 October. The links will be down there, guys. But possibly Carla Stecco's talking on fascia. Talk to me about what you think, the links that how working with fascia can help our people with breast implant illness.
I mean, if we keep it as simple as the scar tissue, it's not linear, right? Like you get cut, well, depending on how you had them implanted, around the areola, the armpit, underneath the breast. For me, I had it under the muscle, which sits on top of pec minor, which is right on top of your rib cage and the intercostal space, right? So that causes just, you breathe, you got friction, you stand up, you got friction. They cut anyone who has under the muscle, they'll cut the pec major so you make space for that implant, right? I almost
both duty of care, irresponsible surgical procedures.
So what I hope, should her schedule allow, what I hope she provides is how to connect the dots. How does that make the rounded shoulder, which causes the neck pain? How many people with implants have neck pain or arm pain or that kind of thing? So when you block this area, this is such an important area for us. It's the brachial plexus. It's made specifically to be fluid, to do different dynamics from the arm, for the thorax, for the back, for the shoulders, for the so much. So many of us with implants become, I'm going to call it trap dominant or hypervigilant in the up, right?
Yeah.
Some of us are rounded too. I mean, thanks to the cell phone and the things. And so we no longer take the lats and engage them and go down. And I know, and I can't wait to take my Chapman's reflexes, but the course, because I like, it would be great to be able to have some sort of neural like hint so your body can do this. But we become so accessory nerve dominant, which is right by the vagus nerve. So whether it's the vagus nerve, which we have so many gut issues with BII, in stress, anyone with stress can have this. Then we irritate the accessory nerve, which then also does this. So it's kind of, it's twofold. It's never just one thing. So Carla will talk about the thorax and the brachial plexus and how this is all wrapped in fascia, because it's not like it's, oh, here's your muscle, here's the fascia, here's the nerve, here's the artery. It all works together. So if things can't slide.
Yeah. And they can't slide. How can they possibly slide when you've got a capsule that your body's building to protect the body from some foreign object that starts leaking the second that it enters the body?
And then you think about all the physios out there listening and the manual therapists, like, you put weight on your body that your body wasn't designed to hold, right? And so they talk in cc's, like 560, I think, is maybe a total, if you have 560 each, that might be a total of 3 pounds or 3.3. That's a lot. When you talk about head tilt, right? Like I'm a PA, like I do the cellular stuff and I do some osteopathy, but I know I saw a chart somewhere where when you have this head tilt, your head in this position is like 70 pounds. Head in this is 50. Head here is something. But when you have implants, you just put 3 pounds on you, which might be in your head like 50 to 70 pounds, right? Or some end, like.
And for those people who are manual therapists who see young girl, like I have quite a few people that I treat who've had to have breast augmentations because their natural breast size has been, double J, and these massive weight, and the bra strap is trapping down across the brachial plexus and just inhibiting that whole space. What's happening with your lymphatic flow when it's catching down there? And they're forward and they're embarrassed, so they're even more forward.
Yeah.
You have this whole problem with these gorgeous young things who are who just should have free breast augmentation. I mean, when you think about the public health, that anyone who is in pain with that kind of body stature with that size breast should, in my opinion, governments
have reconstruction, have them removed. Yeah. What's interesting, and it always strikes home with me, is when I had the implants, I went to get a second opinion to a female plastic surgeon. And no word of a lie, I went in and I thought, okay, because if it's not my breast implants, what is it? Let me do the things to help myself. And she was like, I don't think it's your breast implants causing you the neck pain or the shoulder pain or the ability not to move my left arm. It's got to be something else. And I was like, well, what do people who have large breasts come in and they have a breast reduction, right? Augmentation is with the implants, or reduction would be to remove the things. And she goes, well, they usually have arm pain or neck pain or shoulder pain. And I'm like, this is what I'm complaining about. And these are about a year old, a year and a half old. Do you think it's the breast implants? She said, no. And I'm like, okay, all right. Right. So I'm like, I have brain fog. I have full blown BII symptoms at the time. I'm doing my best. And I'm just like, okay. Like literally just left like that. As I was leaving the door, she writes down on a prescription pad a place where I could buy bras that would support me. She goes, I wear these during surgery so I don't have pain in my hands and I can continue the surgery. for, 4 to 8 hours a day. And I just looked at her, and I had these large crocodile tears just fall down my face, and just was like, I honestly can't, like, that is what happened. Any more than that would be like assumptions. But I was just like, what just happened? And so I knew I needed to explant. And people are just in their own little context and narrative. And when I removed, I wouldn't say everything, like the numbness that I had in my left hand didn't go away right away. I had manual therapy to help with that. And but as my autonomic nervous system calmed, I retrained the muscles to do what I like them to do versus them doing what they thought they needed to do on their own. And life has been good for me.
So you told us of your symptom picture. What is, and I thank you so much for this, because there's probably, I hope that there'll be people that will listen to this, Danielle, and go, do you know what? Everything she's saying is me. And I've been wondering all this time, why am I doing this? What is happening to me? And have no control on themselves. And this is a big and important story that you are offering. So I do thank you very much, because I know there's an emotional component to the trauma that you've suffered. How can we help other people with what BII symptoms? Now, you said the ones that you had, but what are some of the other symptoms that people might go, oh my God, that's me?
I'm trying to think of my clients. By the time I see the clients, they have a lot of issues.
Say gut issues. I'm not familiar.
Gut, like people present people's. Let me share a little bit. Like, again, it's a little bit more from myself, but I feel like I'm fairly typical. I was 48, so menopause is right there, or perimenopause is right there. Yeah. So I assumed my lack of energy was me going through the change. So did all my providers, right? And I'm 55 now, and energy, I go to bed, at 10, and I wake up at 6 or 7, but I have energy now. That vitality, that zest, like, it could be many things. And if you have breast implants, there's a lady by the name of Mel Robbins who had the textured implants. She wasn't feeling bad. She had to her standards, no BII symptoms, but they were recalled. The textured is another conversation that can cause lymphoma, which is called BIA-ALCL, right? And so anyway, that might be another day or another time. But she didn't know they were recalled, because it's not like when your car has their brakes recalled that you get a notice, like you find out, however you find out. So she ended up having an explant, and with a well-versed explanting physician. And when she woke up, she was like, wow, I feel really great. But we all think maybe it's the anesthesia, right? But she decreased her ADHD medicine, and she had a lot more like vitality and energy. And she's like, oh my God, I didn't know what I was missing. She didn't have BII, but her implants were removed, and she had all this energy and still does today. Yeah. So what is this? It's a load our body has to deal with. And if you are not eating a certain way and replacing what you're depleting for dealing with all this catcher's mitt, silicone, making all the things, then your body eventually can become in trouble, let alone what genetics you have. So it is a load that we have to deal with, and it can present very insidious, right? Yeah. It's like, if you think of someone with autoimmunity, it usually takes them 10 years to become diagnosed with Sjogren's, lupus, ankylosing spondylitis, or, like these diseases. You don't have, like, it's not like one day you don't have the disease and then you do, like diabetes, right? Like, it's a process to hypertension. It's a process to autoimmunity, and BII is the same way. So when clients come to me and they already have their autoimmune designation, then, it's harder. If you've had your implants in longer and your catchment wasn't so good, then, then we're still doing the same things and replenishing and getting the drainage pathways open. And for most, once those drainage pathways are open, naturopaths, functional medicine, integrative medicine, they should all know how to do this, right? And for many BII people, they're constipated now, regardless of why. That's one major drainage pathway. If you're not digesting, this is mouth to bottom is one big drainage pathway. And then making sure you're digesting to assimilate and get the nutrition and things like that. So I don't know. I mean, there's a list we can post, from hair loss to fatigue to brain fog to dry skin to rashes to puffiness to edema to hypertension that you never had before, depression that you never had before, exacerbating depression if you've had depression before, anxiety. I mean, it looks like life has just, like, you can't manage life anymore. Like, for some of us, it becomes debilitating, right?
And some of that anxiety is probably exacerbates, because then you don't know what's going on. So then your anxiety levels.
And then you go to the doctor and they say, oh, it's not that. But hair, if you use this supportive device, the weight would be helped, but it's not your breast implants. Like, you get this, and how it lands is that, like, my plastic surgeon, he now knows he didn't know before, right? So we're all learning, but they don't know. My primary care was like, oh, they look great. Like, it can't be your breast implants. The orthopedic guy, when, like, they thought they were working me up for an aneurysm because I had exertional migraines versus the weight of the implants. I haven't had an exertional migraine since, so no aneurysm here, right? Like, people just don't know. So it lands like gaslighting a little bit. Like, and you feel crazy. Like, well, if they're saying it's not this, then it can't be this, but it is this. So.
Yeah. God, it's just outrageous. I've got someone I know very close to me who gets rashes around.
Right. And so, like, as a practitioner before, but if she had, like, before all of this, oh, maybe it's yeast, maybe it's your deodorant, maybe it's your, perfume lotion that you put on.
And playing with deodorants right now, saying it's not, maybe it's my deodorant, I'm not using deodorant anymore. And then every now and then I get stressed and then it comes back up and it's really itchy sometimes. And then there's rashes are kind of in other spaces now, but they're all in areas where the lymph stagnates. So it's at top of groin, armpit.
I was just reading today, there is an article, I think from 2017, on a buttock augmentation and silicone migration to the groin from there, and the hyperpigmentation and the rashes. So listen, any foreign object in our body causes an immune response. Specifically, breast implants is endocrine disruptor, methylation disruptor, autonomic nervous system disruptor. When you look at the autopsies that they've done on ruptured implants, you can find the silicone everywhere from brain to gut, the majority in the gut, which is a good news for us. You keep things moving, breath, lymph, like manual lymph therapy, visceral, even manual therapy is a good thing, right?
So this same person I'm thinking about is pregnant. How does that? Like, is the placenta, is there a safety net there that's protecting that little embryo as it's climbing into babyhood? Like, there's so much.
I tend to like to speak to the data, and we need more data. What I do know is the mom and the baby share everything.
So including silica.
Yeah, anything that's in the mom's system will be in the baby's system. No matter what. The food they eat, the silicone,
they
the
share.
platinum, the tin, whatever it is, they share. how it lands in the baby. Now, babies are phenomenal and they're growing and they can adapt very well. And there are some reports of, we need a big study, right? So breastfeeding, the compromise is the immune system that the mom has, the baby needs, right? So we are passing everything through this area in which the lymphatics are very rich. There's so much ideally fat here, like you want that there. And you're passing that on to the baby. And there's reports of silicone in breast milk. So keep it moving, but like we're learning how to bind it. We're learning how to process it. That's a rough question, Paula.
Sorry, especially when we've only got like maybe 5 minutes left, which is but only because it's a personal, it's something quite close to me. But my brain's going, well, maybe even just before feeding is just getting in there and moving some of that lymph, so we're getting a fresh mobilized before we start to think about baby.
Don't have data, and maybe expelling the first little bit might be beneficial. We don't know. And at the end of the day, making sure the baby is fed and healthy. And I still think, and people might be all like yelling at me at this, I still think mother's milk is more beneficial with or without. That firstborn is going to get the bigger hit. No matter what we have, there's data on that, right? And just love and a good naturopath, functional medicine, integrative physician will know how to help that baby grow. And they're brilliant.
They are brilliant. They are absolutely brilliant. So I'm trying to think if I wanted to make sure that we covered things. I'm not going to talk about Chapman's with the way we work on the lymphatic, this because I know that it works, but that's a whole kettle of fish, and that's not you, that's me.
I know, and I want to learn it. So next time, yes.
But if I really want people to realize that they can actually get to your conference, your summit, and it's a webinar, right? So it's a 3-day webinar.
It is.
Is it a Friday, Saturday, Sunday in October?
Friday evening, full day Saturday, geared for practitioners of every sort. Okay. Sunday will be really geared to the someone who has breast implants and wants to know what to do with it. It's 2022, and we have MRIs now. We have great awareness teams. Practitioners are becoming more and more aware. There's help out there. Yeah. So if you're already sick, I don't want to leave this like a fear-driven thing. Yeah. There are they're not necessarily protocols in place, but there are things we can do and educate and breathe and go through this. And should you have SIGBIC, should you have these things, then there are things that we can do. And there are plenty of people. Australia has a great advocacy. There's a Professor Diva, and Robin Smith is head of the advocacy there in Australia. There's some, maybe I'll give you that information.
Yeah, and we can link that. Is it DEVA?
Yes. Okay. Yeah. He's a plastic surgeon.
So if we've got people who are listening here who might have breast implants and suddenly, and again going, that sounds like me, but I am broke. I don't have the money to have a implanted, explanted. What are some small things that they can do to help them until they can?
Yeah, gently and wonderfully open up your drainage pathways. Poop 2-3 times a day. Tap, right? If you can afford, I like to do something called organic acid testing to see how my mitochondria are doing, to see how I'm digesting, to see what I'm doing with fats, carbohydrates, support your system this way. And,
organic acid testing?
Yep.
And how do you get that from a naturopath or how?
Naturopath, functional medicine, integrative practitioner. I actually went to Australia to learn about all this stuff, right? In Brisbane. So, Yeah, so Australia is rich in this. So nutrient rich, make sure you're digesting, make sure you're pooping, sweating, peeing. And those things should help. There's a way to, I have many clients, not many, but a good bit of clients who choose to keep their implants. Reconstruction after cancer and when you have a family is, you know, a challenge. So there's ways to support yourself in what you choose. I kind of call that biohacking, but like there's ways to facilitate, right? And yeah, it can be expensive.
Yeah. So even just if you've recently had an implant, or I don't even know how recent, but even if you can just take that, like do some self-mobilizing, move the breast maybe to actually keep it like, you know, any scar tissue, as long as it's mobile. And if we're doing passive mobile work, like you obviously can't do active breast movement.
Yeah, I would keep this area just to the breath because we don't know what the movement, you know, if you have textured or the different things. But, you know, moving with normal movement, I think would be good. But if you have implants and you're curious, Eduardo Flores, he's on the Breast Implant Health Summit website. He reads for the silicone-induced granuloma. Right now, I don't know of anyone in Australia who does, and we're teaching people at this summit, radiologists, how to read for SIGBIC. But if you have SIGBIC, then saving the money to have explant may be of best interest. If you don't, you might have bought yourself a couple of years, but have that MRI. And when you have SIGBIC, all that means is it's big enough that you can see it on an MRI. That doesn't mean you didn't have it before. It's just now you can see it, and now you should do something about it, right?
Okay. Excellent. Well, that's giving some people some really good tips and ideas. And it also helps with massage therapists when you're taking history, or naturopaths or whoever listening to this, when you're taking history with new clients and patients, that you might go, these are some of the warning signs that may not be
if someone's not getting well, or they're not holding like they feel great when they get off the table, but 3 hours later, they're still in pain. Like chiropractic adjustment for me and my clients, like when you're inflamed, you're not going to hold that peace for a long time, right? And so like when you've tried everything and there's what else is left, it's a diagnosis of exclusion and an explant right now. So
wow. Danielle, thank you so much for coming. I'm absolutely truly blessed. This is one of the most amazing little Ask Me Anythings that I've had the opportunity to talk to, because it is A, you're amazing and interesting, and B, it's something that is really really, really important for people nowadays, especially because every second girl is getting you know, that peer pressure. You know, wow, I better get breast implants because all my girlfriends have them, and you know, and I can go to Thailand and get them really, really cheaply.
Yeah, Brazil, Philippines, like it's becoming more and more commonplace. Though I have to say, with
explanted, go to a physician who knows what they're doing.
For sure. Yeah.
Please don't go to Brazil or.
Oh no, they're the implanters, right? Like it's very and there are good doctors there as well. So don't. It's all
there are, but you want to specialize. Someone who's actually specializes in explants if you're going to go down that process. Yeah.
Yes. Thank you all very much.
Yeah, thank you so much. Hang around when we go so I can say thank you again. But everybody, don't forget that this link is going to be sent over to Danielle's website, and she can hold it on her Facebook groups and Facebook page and wherever. This is going to be on the YMS group for a couple of months, and then it's going to be dropped down into my membership portal to be housed and kept for those people who are part of the membership program. And I'll be throwing it up onto a podcast in the next few weeks. Anyway, thanks everyone for coming. Danielle, thank you so much. It's been an absolute ripper pleasure, and we'll see you again soon.
Thank you.
See you. Bye.